How should pediatricians diagnose cystic fibrosis?
So I would suggest that when a pediatrician or a physician who is taking care of the children newborn should suspect that I may be dealing with cystic fibrosis. So during neonatal period, if the baby has not passed meconium or first stool in first 24 hours, there is a meconium peritonitis as indicated by abdominal distention, not passing stool, and baby develops a neonatal cholestasis or neonatal jaundice. So these are the red flags during neonatal period, which may be because of the cystic fibrosis. Then during infancy is first 1 year of life. So a child or a newborn or infant presenting with recurrent pneumonia, and there is a history of malabsorption syndrome as indicated by child is passing large amount of foul smelling bulky stool with floats in commode because of the fat content. There is a low protein as indicated by the edema. There is say some anemia or less hemoglobin, and it may be because of the hemolysis, and some children may have a zinc deficiency. So if any of these things are there, think of cystic fibrosis. During toddler, which is between 2 to 5 6 years of age, if a child is having a recurrent pneumonia, rectal prolapse, and not growing well despite good appetite, it may be one of the reason may be cystic fibrosis. And during school going age, if there is a recurrent pneumonia, not growing well with bronchiectasis, think of cystic fibrosis. During adolescence, it may be again a chronic respiratory problem, not gaining weight, delayed puberty, and then, of course, steatoria as indicated by large foul smelling bulky stool. Some children after 10 years of age may develop clinical features suggestive of cystic fibrosis related diabetes. And as I said, there is an increased incidence of allergic bronchopulmonary aspergillosis. So if a child presenting with allergic bronchopulmonary aspergillosis, one of CF may be one of the reasons. During adult, apart from chronic lung diseases, if someone is having a subtle clinical symptoms of respiratory problem but not having babies, or you can say sterile due to azoospermia, CF may be one of the reason. Chronic liver disease and diabetes may be other things. So if any of these things are present, uh, the physician should have a high index of suspicion for cystic fibrosis and should be ruling out it by appropriate investigation.